We've spent a lot of time talking about vaginal births, but there is another type of birth that is incredibly important. Cesarean sections, or as I prefer to call them, cesarean births, because you are giving birth no matter how the baby is born. There are a few categories of cesarean births: scheduled, planned, and unplanned. A scheduled C-section has been decided by you or your healthcare team because it is likely that the outcome will be better than if you tried to have a vaginal birth. Reasons for a planned or a scheduled cesarean might be a breech or transverse baby, a previous cesarean birth or other uterine surgeries, a suspected large baby, multiple babies, a placenta location or other placenta problems, active herpes lesions, or a high HIV viral load. If you are experiencing these, talk to your provider about your options. That will be helpful because for many of these, cesarean births are not automatic. And remember that second opinions are always allowed. As with all interventions, you have the right to information about benefits, risks, costs, and alternatives. Non-emergency, unplanned cesarean sections happen when something happens during the labor that means that a cesarean birth might be the safer option. This might be that labor is not progressing, that the baby does not move down during pushing, or that you or the baby are having a health concern, such as a concerning finding with the baby's heart rate. Emergency unplanned cesarean births are rare, and they happen when you or the baby have a sudden and serious complication that necessitates immediate delivery.
Dr. Amy Avazadeh is an OBGYN and reproductive endocrinologist who has a practice in the Bay Area, and she will walk us through the C-section procedure. She'll also share with us reasons that an emergency C-section might be done, as well as a few tips for recovery. Dr. Amy, I often tell people that there are sort of three types of C-sections or cesarean births, as my midwife heart likes to call them: planned, non-planned, non-emergent, and emergent. Planned being your baby is breech, and with your team you've decided that this is the best way for the baby to be born. Unplanned, non-emergent, meaning that you've been 7 centimeters, everyone's stable, but you tried all the things, it's just not happening. It's time to have a cesarean birth. And then the rare emergency C-section where it really becomes urgent that the baby is born, either for the baby's safety or the parent's safety, the birthing person's safety. Would you agree that that's sort of ultimately how it kind of breaks down?
Absolutely. It's a perfect list. Yes.
Okay. So I also, would say that probably the most common of those is that middle one, right? That sort of non-emergent, unplanned, I keep switching the order, but the unplanned, non-emergent C-sections. In the event that someone is going to have, let's say, that type of C-section, could you walk us through sort of what that experience is like from sort of that moment that the team with the laboring person has decided that it's time for a C-section? What happens next? What's that process like?
For sure. So typically you'll be offered new consent forms, right? So the anesthesiologist will come in and have you sign consent, the OBGYN or one of the nurses or someone someone's going to have you sign consent both on an anesthesia side and a surgical side for the cesarean section. Typically you'll also meet the pediatrician because there's going to be a pediatrician in the delivery room as well. You're all, depending on, who's in the room, who they're going to allow in, you're all going to, get all gowned up with a hat, a party hat, so to speak, a birthday party hat.
A party hat. I'm going to call it that from now on. I love that.
Party hat to get ready to go in. And then depending on what's going on with your anesthesia and the level of anesthesia that you have, we call it dosing up. So they might dose up your epidural. Depending on what's going on, they might have to place one if you have been laboring without any anesthesia so far. So you'll be taken to the operating room. You'll be placed in this position where you're kind of just tilted over to the side, and then they'll put all sorts of covers over you. They'll get your tummy all clean, and then the surgeons will come in. So usually the OBGYN with the OBGYN's assistant. Sometimes it's a surgical assistant or a PA, and midwives can also assist as well at some hospitals. And then they'll just test your skin by, basically just pinching it in little places to make sure that the anesthesia is perfect. And then they'll start the surgery. And they'll usually, after they've started and everything is fine, they'll invite your loved one in to hang out with you and be the paparazzi and take pictures of every single thing. And you'll be like, why did you take a picture of that? That's gross.
Yeah.
But for me, it's really fun. I kind of like seeing those pictures. For me, it's not gross.
Right. And about how long from when they start, they make the first incision to when the baby is born, how long does that usually take?
Usually it's under 15 minutes. It's usually pretty quick to get a baby out. Unless, of course, there's been a history of prior surgery, like a prior C-section or some other sort of bowel surgery, or there's fibroids or some sort of scar tissue they have to get through. Sometimes it can take a little bit longer, but usually under 15 minutes is how long it would take from incision to get the baby out at the, once they do that.
Right. And I always tell people that often during this time, you may, you're going to be totally numb, but sometimes people get nauseous, or sometimes people get itchy, or sometimes they get heartburn. And we always talk about the anesthesiologist and all the amazing things that they can do for you. And one of those things is providing you with anti-nausea medication or whatever. So don't be afraid to communicate, your needs. And something else that I've heard, I have not had a C-section, but I've heard from patients before, and I'd love your take, is that even though you are good and numb, as they're pulling the baby out, sometimes you can feel a fair amount of pressure. Why is that?
Yeah, because what they're doing is they're pushing really hard on the top to bring the baby out down through the incision, and you can feel that pressure. So the anesthesia doesn't take away the feeling of pressure, but it certainly does take away any pain sensation. And so they usually prepare you like when that's going to happen. So you don't freak out, like what is going on here? Like, why is this happening? And you'll see a lot of movement on the other side of the sheet that's there right above your face as that's happening.
Yeah, absolutely. And then there is what I call the Lion King moment, right? Where they take your sweet baby, or babies, if that's why we're having a C-section, and you get to see your baby. And then often the baby is, taken over to get dried and warmed. And then what is the process like for the C-section after the baby is out? What do we have to do next?
Yeah, I mean, once the baby is out, then they have to start the process of repairing the C-section scar and putting all the layers back together again. And so that can take, sometimes it can take maybe 20 minutes, sometimes it can take 30 minutes, sometimes it takes a little bit longer if there's maybe some bleeding that they need to, be dealing with.
Yeah.
Most of the time, having a postpartum hemorrhage is on the more uncommon side. But if there is some extra bleeding and they need to pay a little bit more attention, they might actually have your loved one actually leave the room for a little while until they're done with everything.
Absolutely. And then after the C-section is over, they will bring you into the recovery room. And I always say, it's really important to advocate for yourself as that anesthesia starts to wear off and your pain level starts to increase, really asking to stay on top of that pain medication, understanding that you've had major abdominal surgery and you're expected to be in pain, right?
So I didn't tell you this. I've had 4 C-sections.
Okay.
Yes. So my first one was because they thought my baby was going to be Hercules coming out, but he wasn't. He was a little shrimp. He's now Hercules. He's taller than me at the age of 13 by a few inches, but he was a little shrimp. He was barely even 7 pounds. So I had him at 37 weeks because they thought he was going to be like 11 pounds. They got that wrong. So then I just chose to have elective C-sections after that. So if there's anyone who's a pro at the recovery after C-section, it's me.
Well, can you talk about the recovery after C-section a little bit? Can you share what that was like for you and some tips?
So my husband, like most amazing guy, after about the second C-section, he figured it out. So this is what he says to me. And, what can I get you? What do you need? How can I help you? those are very important sentences for your loved one to use, because how are you isn't going to cut it. What can I get you? How can I help you? What do you need? Like, like there's going to be something that you might need. Oh, can you get me that? Just like the littlest things. Like, I really need that thing that's across the room. Go ahead and get that for me.
Yeah, it's really true. The pain of recovering from a C-section, certainly it varies from person to person, but most people are sent home with pain medication. Is that right?
That's right. And I feel like you have to stay on top of it. And
Yeah.
you can't train yourself into like toughing it out doesn't cut it when you've had a C-section. You can't tough it out. You just had major surgery. And I think as women, I call it the pat, pat, rub, rub. Oh, honey, you're going to be fine. You don't need stronger pain medication. Oh, you don't need a refill. Most people don't need pain medication for that long. But like you said, everyone's recovery is different, especially if you've had a failed induction, for example, and you were pushing for 3 hours and then you had the C-section, you're stretched out in both places. So you're going to be you might even have more pain and discomfort. So that's why I think it's important to talk to your doctor, and not at 2 or 3 in the morning. So always make sure you have enough pain medication to get you through at least 2 days. And going into the weekend, if it's a Friday, I would say even on a Thursday, make sure you have enough pain medication when you go home to get you through till Monday. Because sometimes the on-call doctors, they say things like, oh, I don't prescribe medication when I'm not on call. When I'm on call, you have to wait till your doctor and talk to them tomorrow in the office. And that kind of stuff just, it shouldn't happen. So if you advocate for yourself ahead of time, you can get the prescriptions filled, when you need them. Some people need pain medication even 6 to 8 weeks after C-section, and that is okay. Some people just need the pain medication for 2 weeks, and that's okay too. So everyone's experience is going to be different, and your experience is going to be your experience, and that's fine.
Thank you for saying that, because I think there is a lot of like self-judgment, especially around birth. And so thank you for saying that. Can you talk a little bit about emergency C-sections? Again, these are, pretty rare, the true emergencies where the team rushes in, but they happen.
Sometimes with emergency C-sections, the patient, like for us, like this is what we do. We know this stuff, like this is routine. But I think it's important, again, like what is happening? Why is it happening? What's going on? I think most people nowadays know how to communicate really well with people as to this is the reason why we're doing this C-section. And what you have to understand is if you see people rushing around, they're doing it because there's something going on, like the heart rate is dropping, right? Or you're bleeding excessively and they want to make sure that your baby is going to be safe. But again, it can cause like a lot of trauma and PTSD if you're feeling like people aren't communicating well with you.
Yeah, absolutely. Thank you for sharing that. Well, thank you for talking us through C-sections. And the one piece that I always feel the need to share is just, and you as a C-section mother of 4, that C-sections are birth, and that, certainly a lot of people go into, especially if they're taking a birth class like this, they go into their experience wanting that vaginal birth, and things maybe happen and they end up with a cesarean birth. And I always say, it's okay to be upset if this wasn't the birth you wanted. It's okay also if you prefer to have a C-section, that's fine too. But it's okay if this is, wasn't the birth you wanted. It's okay to be mad and have those feelings. The one thing you're not allowed to do is to judge yourself or to feel like somehow you failed or any of that. Because ultimately a human is coming out of your body. Like, it still blows my mind that this happens and you're still very much giving birth.